Hello guys, this is Miss Gibson. We are going to be going over teaching and learning. So nursing and client education, let me fix this, sorry. We know that nurses provide health education to individuals, families, and communities. If you think about with nursing, we know that our discharge teaching needs to begin sooner rather than later, right? So as soon as that patient gets into the hospital, we want to come up with a plan of care, and then we want to begin that good discharge education. The reason behind that is we want to make sure that the patient has everything that they need as they're going home or transitioning to wherever that might be. And if they don't, we want to have enough time and to make sure that we can get whatever it might be that they need, whether they're going home or to maybe a acute rehab stay, whatever that might be. And we know that that's very important. So, some common factors influencing educational needs include health education level, their socioeconomic status, their culture, maybe their family influences. When you think about providing that education, if their educational level is not high enough and you provide them with, say, pamphlets or brochures, and they can't read those brochures, that is a problem. Most of your health related brochures and pamphlets are going to be printed at a 6th to 8th grade reading level. And the reason behind that is there's been many studies completed over the years that has indicated that that is a generalized educational level where most people can read, which is that 6th to 8th grade reading level. And then also the pamphlets and brochures need to be in layman terms. There doesn't need to be a whole lot of medical terminology in those because we don't know if the patient or the caregiver is going to be able to understand that. Some other factors might be emotional status, spiritual factors, health perception, willingness to participate, developmental level are all important to consider. Client education provides clients with information and skills to maintain and promote health and also to prevent illness. We can also provide that nursing education to restore health and to adapt to permanent illness or injury. You know, if they were in a motor vehicle crash and they're now paralyzed from the neck down, we've got to give that good education as well as support and resources for them to be able to adapt to that big change. For some reason, my computer won't work with me. Domains of learning, we have cognitive, affective, and then psychomotor. Your cognitive learning, this involves cognitive behaviors. One example is your client learns the manifestations of hypoglycemia and then can verbalize when to notify the provider. Affective learning, this involves feelings, beliefs, values. One example is affective learning takes place when clients learn about the life changes necessary for managing diabetes. And then they can discuss their feelings about having diabetes. In other words, with affective learning, you want to get on their level, meet them where they are, and get to understand what their fears might be or why, or if there might be an issue or a barrier to them understanding diabetes. We know that diabetes is a very broad diagnosis, from diet to checking the blood sugar to using a glucometer, sometimes using an insulin pump. So all of those things go into your education. And you've got to meet them where they are as far as what are their feelings on learning this new material. And then the psychomotor, this is gaining skills that require mental and physical activity. Clients practicing preparing insulin injections. So the psychomotor skills is them learning how to do something. Sorry, my throat is getting scratchy. So here's a question that we will go over together. The ostomy nurse is educating the client about the new colostomy. Sort the nursing actions into cognitive, affective, or psychomotor domains of learning. So the first one, the ostomy nurse encourages the client to share their feelings about their colostomy. As soon as you see feelings, you need to think about affective. The affective always refers to feelings and emotions. The client performs a return demonstration of emptying the colostomy bag. Anytime that your patient is doing something, using their hands or performing an act, that is your psychomotor. And then the ostomy nurse provides the client with a list of foods they can eat and foods they should avoid in their diet. So this would be the cognitive domain. It involves remembering, understanding, applying, analyzing, creating, or even evaluating. And this slide just goes over what I just told you all. You're welcome to pause it where you can actually read through that again. So the next slide is adult learners. Plan to teach adult clients in a different manner from children. Adults can identify what they need to learn. They can build on prior information and experiences and can be influenced by other life factors. And hopefully you will have a mutual goal. You know, you and the adult learner will have the mutual goal of learning what barriers there may be and what your goal is as far as with a new diagnosis, a new medicine, maybe new colostomy. So there's new procedures that patient will have to learn. Teaching groups of 6 or fewer to increase learning and satisfaction. You're going to teach more than one client at a time. You can use different types of learning strategies, and then also the learners can interact. So when you're teaching in groups, this a lot of times new diabetic patients can be referred to special groups where it's all new diabetics, and maybe they come in to speak to a dietitian in regards to a diabetic diet. It might be that it's a patient with a new colostomy, and they can be referred to a group of individuals that's all that each of them just got a new colostomy, so they can kind of learn together. And you really have to gauge how your patient or your adult learner learns. Do they learn hands-on? Are they going to do better in a group setting? Or would they do better just one-on-one where you and the patient sit down privately and discuss that? And that's all part of effective communication as well. So the next is assessment and data collection. These are all the things that you need to know. before you sit down to provide that education. You want to know their learning needs. You're going to assess and monitor those learning needs. You're going to evaluate the learning environment. Identify their learning style. Are they visual? Are they hands-on? Identify areas of concern. Do you notice that they have a low reading levels? Maybe they're in a lot of pain. Maybe they have a lot going on at home, so there's a lot of distractions. You're going to identify any available resources, such as is there community resources? Do they need financial assistance? You're going to identify developmental levels, determine physical and cognitive abilities. If they can't perform it, do they have a caregiver or a loved one, maybe a significant other, that can perform the colostomy care or perform the glucometer checks? Identify specific needs such as visual impairments, decreased manual dexterity, learning challenges. You also want to think about if there are learning challenges or visual impairments, what do you need to do? You're there to advocate for that patient. So what resources are available, and what can you do to help that patient get to where they need to be? And it may be community referrals. It may be having home health come in to help with that new colostomy education or that new diabetic diagnoses. Determine their motivation and readiness to learn. That's major. If every time you sit down to provide some education with them, say they're playing on their phone, well, they're not too motivated to learn. So that goes back to having that just very transparent conversation of, do you want me to come back another time? Is this not a good time? Or asking those open-ended questions where that you can meet them where they are. You also have to consider the client's culture, personal values, and how that will affect the client's willingness to learn. Identify the client's ability to make health decisions by determining their basic understanding of health and what the client believes affects health and illness. So it really all goes back to, when you sit down to have that open communication and provide that client education, you want to figure out any barriers right off the bat. What barriers are there? And from there, you can start working through those barriers and figure out what needs to take place for you to give them the education that they need to be successful and to manage whatever their diagnoses might be. So now let's look at another question. The ostomy nurse is providing pre-op education for the client who is scheduled for a sigmoid colonoscopy. Not colonoscopy, so sorry. Colostomy. The nurse should identify that which of the following client statements is an indication that the client is ready to learn. I will not look at my incision after the surgery. Will you give me pain medicine after the surgery? Can you tell me about how long the surgery will take? And I can't remember what my doctor told me about the surgery. So, can you tell me about how long the surgery will take? The rationale for this is when recognizing cues, the ostomy nurse should identify that asking a concrete question about the procedure indicates that the client is ready to learn. So if you look like at option B, they're just concerned about their pain medicine. Am I going to be hurt? Am I going to be in pain? So that's where their focus is. And then A and D means that they were not ready for you to provide any education. Their mind was somewhere else. They were thinking about what they were going to post on Facebook or thinking about a situation at home. And A, they obviously was not listening at all, because we know that any kind of education that was provided would not have been, I will not look at my incision. And then next we're going to plan. So in the planning stage, we are identifying mutually agreeable outcomes. We're going to prioritize the learning objectives with clients' needs in mind. We're going to use methods that emphasize the learning style. Some strategies include demonstration, lecture, role playing, simulation, visual aids, like images or objects, equipment, and sometimes you can also use media resources. You're going to select an age-appropriate teaching method as well as materials like we've already talked about. Speak and provide print materials at the 6th to 8th grade reading level. Avoid nursing terminology such as administer, monitor, implement, assess. You want to make sure that you don't use any of those. Speak and write in the second person, not the third, such as your leg, not the leg. Avoid using all capital letters. Minimize white space and small type in print materials. So the white space can be can be a site of distraction. And small type, you don't want to do that because you don't know about if they need any kind of visual aids. You can also speak and write in active voice, such as take the medicine, not the medicine should be taken. You're going to provide electronic educational resources as needed, videos, mobile apps, that kind of thing. Use reliable internet sources to assess information and support services. And then last, you're going to organize learning activities to move from simple to more complex. So as you're planning your education, you're going to start with the simple stuff, the things that you feel like the patient can understand right off the bat, and then move into the more complex stuff. Incorporate active participation in the learning process. You always want to keep the patient or the caregiver involved. And then schedule teaching sessions at optimal times for learning. Teaching ostomy care while replacing the patch is a perfect opportunity for some education. You can teach while you're doing it. Implementation, you want to create an environment that promotes learning. You want minimal distractions and interruptions. You want privacy. You want to use therapeutic communication such as active listening to develop trust and promote sharing of concerns. You want to make sure that wherever you're implementing this education, you're providing an environment that they feel safe in. You're going to consider the client's values, help the client understand why the information is relevant or important. Review previous knowledge and experiences and use this information to relate the content. Ask if maybe someone in their family's ever had a colostomy, or if they know what a colostomy is. Maybe that's what your baseline can be. That's where you're going to start. And then you can teach from there. You're going to present steps that build towards more complex tasks. You're going to demonstrate psychomotor skills, allow time for return demonstration, and then provide positive reinforcement. You're always going to give that positive reinforcement. And then always congratulate them. Hey, good job. You learned that. That's excellent. Those types of things. Then evaluation. You're going to ask clients to explain the information in their own words. Observe return demonstration. Use written tools to measure the accuracy of information acquired. Evaluate the client's progress without appearing judgmental. Continue to provide support and encouragement throughout the whole process. Ask clients to evaluate their own progress. Observe nonverbal communication. Reevaluate learning during follow-up telephone calls or contacts. And then you're going to revise the care plan accordingly. Teaching sessions that might need to be repeated, or the client might need to practice psychomotor skills to demonstrate learning. So during the evaluation period, which, evaluation is not only at the end, you also want to evaluate through each of these steps, making sure that the patient is making some progress each time you meet with them. All right, so the next one is, this next is a question. The ostomy nurse is preparing to educate the client about caring for the new colostomy. Place the following actions the ostomy nurse should take in the correct order. So the first action the nurse should take is to assess what the client knows about colostomies. The ostomy nurse can base the education for the client on pre-existing knowledge. The second action the ostomy nurse should take is using the nursing process, is to plan to use and let me start over. The second action the ostomy nurse should take using the nursing process is to plan to use instructional materials to educate the client about colostomy care. The third action the ostomy nurse should take using the nursing process is implementation. The ostomy nurse demonstrates how to care for the ostomy. The fourth action the ostomy nurse should take using the nursing process is evaluation. The ostomy nurse evaluates the client's understanding of how to care for the colostomy. So we're going to assess. Then we are going to use materials to educate. We're going to allow them to demonstrate, and then we're going to evaluate what they have demonstrated. So assess, plan, implement, and evaluation. Now, factors affecting learning. You have perceived benefit, cognitive and physical ability, active participation, age and educational level, appropriate materials. Some barriers, which we've talked about these, is fear, anxiety, depression, physical discomfort, pain, fatigue, environmental distractions, cell phones going off, people knocking on the door, visitors coming in and out, sensory and perceptual deficits, and then psychomotor deficits. Just make sure that you're following the nursing process. As long as you're following that and you're starting with any barriers that you might notice, and then you're working your way out from those barriers right from the get-go, you will be fine. Make sure that you're asking those open-ended questions, and make sure that you're going off of some of the experiences that you've had. But you've got to meet your patient where they are. You got to ask them those questions, figure out what their fears are, figure out who their support system is, and maybe that support system can be there during the education just as a backup. All right, and that is it. If you have any questions, please don't hesitate to reach out. You can email me anytime and I will get back with you. Have a great day. Thank you.